session to remove some fees on kids, so it's like even just saying your cross out, removing language, it's nice. But
Hi, Ryan.
Am I late?
Nope, right on time.
I was like,
I know, I didn't mean to spook you with my text. It was a gentle push. It was just a hey.
yeah, we had the fair chance employment thing, so it ended right at 12, but they were tabling, so they were just going around at the end, so I had to kind of get home. Luckily, it was only like 5 minutes away from my apartment, so sorry if I got on a little late.
I
Good
hope it went
afternoon.
well. Oh, hey, Daniel.
Good to see you all.
I think we're waiting on one more panelist, but she should hop on whenever. So, Damien, you're free to get us started whenever you're ready.
All right. Thanks so much to all of you for being here and taking time out of your busy schedules to discuss these important issues here in Oklahoma. Thanks for joining us. Well, welcome to everyone here and at home who might be live streaming today and who'll see this on YouTube and in our various social media. My name is Damian Shade. I'm the Executive Director of Oklahomans for Criminal Justice Reform, and this is one of our community conversations about a very important and timely topic here in Oklahoma right now, the status of our mental health system and the way that mental health system intersects with the criminal legal system. I often like to say that it's not really accurate that Oklahoma has an incarceration crisis. It's more accurate to say we have a mental health crisis that we've converted into an incarceration crisis. Oklahoma is experiencing an unprecedented mental health and substance use crisis. According to the Legislative Office of Fiscal Transparency, over 100,000 Oklahomans are currently eligible for mental health services and not receiving them. Oklahoma actually ranks near the bottom in our nation for mental health spending per capita. And I'm sure our amazing panelists will really delve into the way that those failures in access have impacted regular families, regular folks across the state, and made our criminal legal system demonstrably worse. I'm going to take a moment to introduce our esteemed group of panelists. Going to start with Brittany Hayes from the Healthy Minds Initiative. Brittany, you want to talk a little bit about yourself and what you do and what Healthy Minds is?
Sure. So my name is Brittany Hayes. I'm the policy director or the director of policy research and engagement at the Healthy Minds Policy Initiative. And we are a nonpartisan group of policy analysts and community activists, workers who really look at how to increase mental health access to all Oklahomans. And we do that in a couple of different ways, one on the policy side, but two, really working with communities and providers to maximize the services that they're able to provide.
That's amazing. Wonderful. Wonderful. We also have from the Oklahoma Policy Institute, their criminal justice policy analyst, David Gately. Do you want to introduce yourself to the audience and talk a little bit about your work at OPI?
Yeah, sure. Thanks, Damien. As Damien said, I'm the criminal justice policy analyst at the Oklahoma Policy Institute. We're an independent nonprofit that advances equitable, fiscally responsible policies, hopefully leading to expanded opportunity for all Oklahomans. We do that through, like I said, nonpartisan research, analysis, and advocacy. So my role is I'm just looking at the criminal justice system. So reducing the amount of people going to prison and jail, and then hopefully creating policies and systems that help them regain their lives after incarceration. So I'm excited to be here because not only is it Mental Health Month or Awareness Month, but this is a major issue when we talk about the criminal justice system. So thanks for having me.
Awesome. Thanks so much for being here. We've also got a couple of OCJR's staff members and colleagues. I'll go ahead and start with Whitney Brown. It looks like who made it on. She's one of OCJR's ambassadors. Would you introduce yourself and just talk a little bit about what you do at Oklahomans for Criminal Justice Reform, Whitney?
Awesome. Hello, everyone. My name is Whitney, and I am, as Damien said, an ambassador with OCJR. And I have recently been released from prison in August. And I have been on a journey to restart my life. And it has been a blessing to be a part of OCJR doing that, because I've been able to learn so many things regarding advocacy for those who have been in the criminal justice system and that have been trying to do the same as I have. So I have just been learning about so much in the legislative area, so much in the mental health area, so much regarding things that would help just get us re-entered into the community with without feeling the shame and the stigma of having being a felon. So I am just excited to be a part of this call and to share what I know about mental health and being a part of the criminal justice system.
Awesome. Thank you, Whitney. And lastly, we have Ryan Mukes, who is also one of OCJR's ambassadors. Would you talk a little bit about what you do with OCJR and introduce yourself to everyone?
Hello, everyone. My name is Ryan Mukes, and like Damon said, I'm an ambassador with OCJR, and it's been a real blessing for me, considering that I was once incarcerated and I've been out of prison for 13 years and still trying to get my life. Well, not necessarily get my life together, but to get to a point to where I have a career and things are easily for me to sustain better living for my children and things like that. It's been a tremendous blessing being a part of this whole conversation in a program in a nonprofit organization, for the fact that I get to see how things work from the other side. I've already been incarcerated and I know how things work when you're incarcerated. So it's real wonderful for me to be a part of these conversations, knowing that some people are starting to notice and understand that we need a lot of work in Oklahoma criminal justice. So I'm so proud to be a part of the conversation as well.
We're so grateful to have you here. All of your guests, thank you for joining us. During this conversation, we're really going to talk about the intersection of mental health and incarceration. As David mentioned, as part of Mental Health Awareness Month, we really want to explore the continued need for reform, for advocates to prioritize treatment and rehabilitation over incarceration, and really focus on the transformative policies of things like State Question 780 and State Question 781, which I know are wonky terms that our experts here will really happily explain for us. So our first question to the panel is, can you share some insights on the significance of Mental Health Awareness Month and the importance of mental health well-being on reducing stigma? And I might direct that first piece to Brittany, and then anyone else who wants to follow up on it.
Sure. So I think Mental Health Awareness Month is really an opportunity to think about mental health and how it impacts every aspect of our lives, and it impacts everyone in different ways. But I think primarily it's really about focusing on that stigma reduction. We live in a state that has really high levels of mental health prevalence, really high levels of drug use, and we seem to correlate that as Oklahomans to either a moral failing or a lack of self-discipline. And that is really where the issues begin, is it's sort of like this haves and have-nots and do's and do-nots. And I think when we're starting from that place, where we have such high rates of stigma, and we're also just like a really punitive society, that's a lot of why I think awareness months count, and that it's more than just having good mental health, right? It's about well-being and talking about social determinants of health and how things like having housing and having stable employment really are what lead to good mental health and good mental well-being. And when we start to break those things down and push them into the haves and have-nots category, we really create this society that's like stagnated and broken, and really can't have conversations about how to solve some of the issues that are plaguing our state.
Really great points. I know several of you mentioned in your introductions talking about the stigma, particularly around mental health and ways that has impacted this crisis and sort of made these problems worse. Would anyone care to talk about either personal experiences with that stigma and the way it's affected life, or ways that you see that being an important part of this conversation too?
I would like to touch on that. Most definitely, me being a Black male is a big stigma for my family. They're more conscious of it now, but I have a lot of friends and that have been through so much mental trauma, and I just try to get them to realize if we can start having some focus on our physical health in our community, it would start to lead to more better mental health, because that's what was key for me, being able to get my mental health in some kind of better shape than what it had been, navigating the system. And I just wanted to put that out there, that so it's easier for me to start from a physical standpoint to be able to lead over to get people to start thinking about their mental health, right? And for me, the more physically healthy I became, my mental health started to follow automatically. It just made me more conscious about decisions I was making, the food I was putting in my body, the words that were coming out of my mouth, and such things like that. And I just think if we could start really getting people to realize that physical health is linked to our mental health. It's not just for us looking good and, wanting people to see that we look good, but also for us to feel good about ourselves and in the way we think and stuff like that too. So I just wanted to add that part in as well.
I think a little fun fact too is, like, even more specific than physical health is dental health has the most relevant connection to mental health. Like, nothing gets to your brain faster than a toothache, essentially. So if we can focus on dental health as a part of that physical health, which I think in Oklahoma, because those systems are so divergent on the insurance sphere, that's another thing to really push to, is go see your dentist as much as you go see your primary care doc.
That's remarkable. That's a point I don't think most people, not just Oklahomans, would put together. That's really interesting. Um, how do we think the issues around mental health and then issues around folks struggling with addiction and substance use, how does that sort of intersect with the criminal legal system from you all's perspective? I'll put that to David or Whitney, either one of you.
Yeah, I can start. I think one way it relates pretty obviously is because we've chosen to make mental health and substance abuse issues, or what we've historically called drug addiction, to be criminalized in Oklahoma. Brittany points out how our society is so punitive on these issues. So to me, it means that when somebody's manifesting a mental health issue or a substance abuse issue, that can actually send them to prison or jail. Or even just involvement with police or law enforcement generally, which in some communities can actually be deadly by itself. So when someone's having a prolonged mental health issue, again, that manifests in a way that we see as criminal, we immediately jump to the idea now it's worth locking them up or putting them away with no serious care, no serious evaluation. And I think a clear example of that is, who do you call when you see somebody having an emergency? What are the options we've had historically? Most of the time you call 911, which leads to a police response, which in my mind might be some of the worst people to address a mental health issue or mental health crisis. Not because they're bad people, but because they're not trained to do that. That's not their job. It shouldn't be their job. And then we obviously see this kind of intersection of the justice system and mental health issues in our prisons. And I would also say most acutely in our jails. You can look at the Oklahoma County Jail, where I'm from Oklahoma City, where it seems like somebody is losing their life almost weekly at that detention center. And most of the time, if not all of the time, they're suffering from some underlying health issue. And that includes untreated mental illness. We can even look at Cleveland County recently in the news, if you've seen the tragedy around Shannon Hatchett, who lost her life while she was experiencing an acute mental health crisis, and was put in jail and left there. She had no care. She was untreated and uncared for days on end. So these are just some of the examples and some of the tragedies that are made public, but they're happening in our criminal legal system every day, everywhere. And when it comes to substance abuse, I'll add, we're actually going in the wrong direction when we look at this intersection of substance abuse in the criminal justice system. Just this session, lawmakers voted to make a new felony for simple drug possession. It's wrong. It's going to lead to more harm. It's going to lead to more people in prison. And even more importantly, it's going to lead to less safe communities for all of us. So we don't need to tie treatment for mental health or substance use issues to criminal penalties. And when we force people into treatment by using the kind of carrot stick method, the stick being really long sentences, that also doesn't work. So bottom line, we need to uncouple mental health and substance use issues with the criminal justice system completely, full stop. They don't mix, they shouldn't be mixed. That should not be the solution for how we look at these issues.
Whitney, any thoughts on that same topic?
Absolutely. Just as David was saying, most people who are incarcerated have mental health issues. And I noticed also while being incarcerated, there's a high chance of you developing mental health issues while being incarcerated. The anxiety and the paranoia, PTSD, all of that is heightened or even introduced once you are incarcerated. And then the treatment that's available once you are inside, it's not very good either. The mental health doctors are there to basically prescribe you medication and kind of send you along your way. There's not really treatment actually geared towards getting someone help when you're on the inside. So it's just a reoccurring thing, or it gets worse once you're in there. And then that will also lead into substance abuse also, because if you're not treated correctly from the doctor, then you'll most likely be wanting to turn into substance abuse just to kind of get a break or get a release from the pressure that you're under when you're having a mental health crisis. I've also witnessed someone whose crime took place while a mental health episode was going on, as David was saying. Someone who had schizophrenia and burglarized a home and due to a mental health episode. And of course, when the police were called to the scene, they did not address the fact that he was having a mental health episode. And then upon speaking to him afterwards, I kind of asked him, like, what was going on, or what was you thinking? And he was kind of shy and ashamed. It was, I don't know, man. I was, in talking about how he was under the episode of his schizophrenia episode. So it's really kind of hard. And like David was saying, also, who do you call? And just being involved in that, I learned myself that you would call COPS or something like that. But how is the person that's being burglarized to know that? Or how is the police to know that? So it is kind of a touchy subject.
It's really important to think about. In your experience, what are the key challenges individuals with mental health conditions face within the criminal legal system? And then how does that impact their chances of successful rehabilitation? I'll start with Ryan, and Whitney, if you want to jump in on this one as well, you can too.
Well, just like I'm gonna piggyback off of what Whitney was said. Once you've been incarcerated and you've been released and you have all these mental issues, you don't even realize once you first come home and you're trying to navigate starting life over and bettering yourself. Not only that, if you have children and family that's close, you have a lot of issues being able to communicate with them and have them understand you. Not even wanting to be in a room full of people is kind of when you first get home, it can be a challenge as well. So and just knowing that, I feel like that the system knows these things and they use mental health to keep the numbers up. So like Whitney said, police will come up on the scene and obviously see that someone is having in some sort of mental state, but they'll proceed to interact with them as if they're a normal person. And it gets more combative because the officer is getting confused, which he's probably already had a stressful day dealing with other things that's been going on in the community before he got there. And it's like, with all these issues, when you go to see a probation officer, because when you get out, you're on probation, your nerves are sent through the roof when you have to walk to any kind of federal building or state building. These things automatically starts to bring up the mental issues that you have. So, and then they're looking at you like you're paranoid or you're trying to do something. And it just makes for anyone to have any understanding and to get any help, because no one wants to address the fact that mental health is the main reason that a lot of us end up incarcerated at all. It can start from when you're a child and you're seeing people incarcerated, and then you just automatically go into a shell and it makes it hard to be able to see who wants to help you. It just shuts you down from any help that you could be getting because you have all these mental issues. And like I said, it's just hard navigating to get anyone in the court systems to understand. They understand it, but just to acknowledge it and I have never heard of any facilities that the state had. Maybe Bonita, I think, was a state facility that they used to have for mental health, but they put people with mental health issues incarcerated, and it starts to rub off on everyone around them. Even the ones with strong mental health. Once you get around with people having mental health issues, it starts to put doubt and make you think about certain mental health issues that you have as well.
That's a great point, Ryan, that I would like to talk about also. And I experienced that with being incarcerated. I had a roommate that mental health was always at a point where we would have to be concerned about it or just kind of shelter her because we knew of her mental health issues, and we just kind of would keep her under our wing just to keep her from having any further issues. But that I would remember times where I would have to communicate with the classifications officers and let them know that if they were planning to put someone else with mental health issues in the room with her, then they might needed to rethink about that or try to maybe maneuver or do something different, because that person would trigger the lady that was in the room with me. It just wouldn't mix. I remember having a couple of conversations with the warden and with the deputy warden and the classifications officers, the chief of security, just letting them know that, like, you may not want to put her in here with Miss Jackson because it just may not work for the both of them. And I speak to that from a mental health standpoint and from a spiritual standpoint, just of noticing those things. And also when you're on the inside as well, there's things that can help you get to a point where you can get out faster, like taking classes and leveling up and things like that. And when your mental health is not in a good spot, you are not focused on those things. You just can't. So like, that's a major holdback as well. And when you're just not can't pull it together mentally. You can't focus on those things. And then you're doing things like racking up misconducts and stuff like that and it's all behind your mental is not being taken care of. And then even the officers and things like that too would make it so much of a point. Make sure you make your mental health appointment. If you miss your mental health appointment, you're gonna have this consequence or whatever. And so it's like they know the seriousness of it too, but then at the same time, the mental health trailer is what we called it, is not the place to go for your mental health. So it's kind of a contradiction, because you can pretty much tell the mental health doctors anything you want to get any pill you want when you're in there. So it's just like, I don't know, which way do you go?
And then another thing that to piggyback off of what she said is something I experienced is keeping a job with mental health issues. A job is a job, and a lot of them are highly stressful on top of the mental health issues that you already have, and you're supposed to maintain a job while on probation and parole. I don't think the system realizes that the pressure they put on us with all the fines and fees, the pressures we have from having children and family, and then navigating a job is highly stressful for anyone on top of that. But once you've been incarcerated and you have all these things hanging over your head, fines and fees to pay on top of regular life things, it makes it a little difficult to maintain and keep a job, especially if it's just a job, because there's high turnaround on lots of jobs, and it just makes it hard to establish yourself to be able to have a career and to be lift yourself above a $15 an hour job if you're lucky enough to even get $15 an hour. And I don't think people realize that a lot of this stuff is tied to mental health. If you're working a job and you got kids to take care of, and this job is stressful, and you still have to worry about going to check in, paying your fines and fees, it just continuously adds to more stress and give you more issues with your mental health. So I don't think that the court systems and probation officers, take that into consideration. They're just putting pressure on you. Get a job and keep a job, and then the mental health that we do get with having low income insurance, just like Whitney said, even when you're released, if you go to Mary Mahoney or somewhere that gives you free healthcare, they pretty much just want to subdue you and put you on some kind of medication that suppresses you, which therefore makes it even harder to do your work or take care of your family or spend time with your loved ones. So it can get really thick and deep as far as mental health and navigating the system.
Yeah, there's a lot there that you all are both talking about. What are some of the main barriers and misconceptions that prevent society from fixing this, right? From investing in rehabilitative and addiction treatment services as alternatives to incarceration? This one for Brittany and David. What are your thoughts on that?
You can go ahead, David.
Well, I would just say that I think the top barrier in my mind is the idea that the way to help people is by involving them in the criminal justice system. It feels like that's like the only solution we have for these issues. And that's a system that's not equipped at all to help people who need it most. And maybe most of the public agrees with that, but I think our lawmakers have a really hard time making that association. And also the association that we need more funding for these services as an alternative to just pouring more money into the incarceration, prison and jail. And again, you can see that play out this session as we start to roll back some of the reforms we made. Like I said about simple possession, now that opens the door to becoming a felony again, which is what Oklahomans did not want when they voted to make it a misdemeanor so many years ago. So I don't want to be too cynical on this question, but I think that these lawmakers go to where they think voters are, and too often that feels like tough on crime, show no mercy, pull yourself up by your bootstraps, and this is your personal issue that's interfering with our lives or whatever it may be, so we're going to throw you in jail or prison. I think it's wrong, but I do think that represents a major barrier to the kind of programs we know we need here in Oklahoma. But I'd love to hear what what Brittany thinks too.
Yeah, so context is really important for me. And I was sort of thought of this as Ryan was speaking and mentioned Vanita. In the 1960s, we had this huge culture of hospitalization. If somebody is mentally ill and you don't know what to do with them, you just stick them in a hospital. And so in the 60s, we said, well, we'll close out all of these institutions and we'll invest in community mental health. Well, the first thing happened, but there wasn't really any follow-up with the investment in community mental health. So that left jails and prisons to become these de facto mental health hospitals because there wasn't any investment in the 60s. And anytime that there's been conversations about how to make that happen, it's just sort of like, it's polite conversation that these sorts of things need to be funded. But I think that history speaks a lot to how we view individuals who experience mental health conditions or who do use drugs, because it's sort of antithetical to how they think things should be. But I think the solution to that is not to reinstitutionalize people and open up those hospitals. It's to take the cost savings that we had realized and put those into community mental health and actually have community mental health. I will say that Oklahoma is one of 3 states in the country who now has a new mental health model called certified community behavioral health clinics. What these certified behavioral health clinics don't have, however, is good working relationships with the criminal legal and civil legal systems. A lot of the research says that some of these alternative to incarceration programs like treatment courts are great if there's good cooperation and collaboration between partners, but that's what's not happening. There's not any collaboration between the mental health treatment side and the criminal legal or civil legal system. And because you have that sort of breakdown, that's where we're seeing incarceration becoming the answer instead of exploring treatment opportunities. But I think that the other issue for me is that it really depends on what county that you live in as to what access you have to mental health services. And that's a problem. Like, it's a privilege to live in Tulsa County, right? Because I know that there are some available mental health professionals. If you're in Beaver County or McCurtain County or wherever else, you might not have the same access. And I think there you'll see even higher levels of correlation between experiencing a mental health condition and finding yourself incarcerated for something that wouldn't be considered criminal. It would be considered something that you would want to seek mental health help for.
That's interesting. It's remarkable to think that just your zip code, the fact that you happen to be in a different place than someone else, could determine whether or not you go to jail or prison or go to a doctor. That's really remarkable. Many of the conversations around mental health and the legal system have been focused on State Question 780 and 781, which I know most folks probably have no idea what those things are. So David, could you maybe give us a quick primer on what was State Question 780 and State Question 781 and why are they important?
Yeah, so thanks for this question, because State Question 780 and 781, as Damien mentioned, it does feel wonky, but it represents some of the most important criminal justice reforms our state has had in the last decade. And it really marks the point where I think we started to see a transition away from hardcore mass incarceration, which we did for decades before, to starting to think about it differently. So in 2016, voters, I want to be clear, this was a state question, meaning voters went to the ballot box and they voted yes or no. This was not lawmakers. This was the people who voted on this. So in 2016, voters approved both of these state questions, 780 and 781. And what 780 did is it reclassified a few felonies, but importantly, for this conversation, it reclassified simple possession of a controlled substance from a felony. So this is drugs, possession, just simple possession of drugs, from a felony to a misdemeanor. And that matters a lot because a felony usually means longer sentences, higher court costs, time in prison, for example. And then also that ongoing felony status that somebody carries with them long after they've served time in prison. And you know, we've already talked about some on this call, but that can really set you up for issues finding a job or finding housing or other things. And so changing from a misdemeanor to a felony makes a big difference when we think about these issues. And what it really boils down to essentially is that voters chose to make drug abuse issues a misdemeanor instead of a felony. And they wanted to treat this as the health issue that it is and not the prison or jail or criminal justice issue that we made it. And the good news on this, after becoming law and being implemented in 2017, we saw a marked decline in the number of felony charges being filed, as well as the number of people going to prison. In other words, State Question 780 is working and has been working as intended and as voters wanted when they voted for it in 2016. So this is where State Question 781, the companion state question to 780 comes in. So also overwhelmingly approved by voters, 781 directed the money saved from making all of those felonies to misdemeanors and less people going to prison and less people being charged, to take that money saved and put it into mental health treatment and substance use programming at the county and local level. And this means in every community across the state. As Brittany mentioned, not just Tulsa County or Oklahoma City or Oklahoma County. This is every county across the state. Money meant to be spent on mental health programming and substance use programming. But the issue here, and until just like last week or 2 weeks ago, there has not been a single dollar of savings allocated to this fund or to these programs across the state, meaning lawmakers have not held up their end of the bargain. Voters approved it overwhelmingly, and lawmakers have said no for 6 or 7, going on 8 budget cycles now. So that's 780 and 781. Again, 781 has never been realized. We've never seen it in action because the money has not been there. So we'll probably get to this in the conversation later, but just this session, finally, we saw a bill passed and some money allocated to this. But again, 780 reclassified drug laws, and 781 was meant to take those savings and reinvest it into community programs, and that hasn't happened. So I hope that's a good kind of primer on this conversation. But those are the 2 state questions.
That's great. Hey, I might have Brittany unpack just one last piece. David mentioned that there was a bill that passed this year and some amount of money. I guess it's $12.5 million in this first investment. Can you talk about why this is an important investment and what you kind of think this means from your perspective?
Yeah, so I think this investment allows for the counties to really figure out what their own citizens need. Somebody who is experiencing a mental health crisis in one county has a different experience than somebody in another county. So this really allows, so basically how it would work is this $12.5 million would be split among counties based on things like population. And then they would then tell the Department of Mental Health how that money could be used to improve services in their particular area. So this could be educational services, employment services, treatment services. So that county who has the best sort of feel for what their people need would be able to determine how that money could best be spent. My favorite part of it is that counties can work together. So I think we don't really live in a time where, I mean, unless you're in Osage County, which is gigantic, where you don't work with other counties around you. So this allows smaller counties to sort of pool their money together, figure out what folks in their area need, and then put that money in an investment toward what they need. Like we said before, in Tulsa County, there might be enough services that are just treatment services, but there might not be as good of employment services or as good of educational services. So it's really, it makes sure that this isn't a one size fits all solution. It allows counties to really tailor programming to what its citizens need.
I love that. That's really, really interesting. I'm going to skip down a little bit in our questions because I want to really talk about the status of current solutions that exist and kind of experience people might have had with them. This one I'm going to direct to Ryan and Whitney. Were you offered mental health or addiction treatment? I think you've spoken just a little bit about it while incarcerated. And is it easy to avoid addiction in prison, or is it hard to avoid drugs with the contraband situation? What would you like to see change about mental health and addiction supports that actually exist inside the system, for Ryan or Whitney?
I'll go first. So when I was incarcerated, I was at a private facility. They did not, the only mental health they offered was a pill line. You go to that window, you tell them what's wrong with you, and they hand you some pills. I wasn't with that. So I asked around. I had to ask the guys, the older elders on the yard, hey, is there any? And they were like, you need to go to AA. And AA was voluntary, and we had volunteers come in to do the AA. So these people done this for free. The facilities would not pay for someone to come in and give us any kind of mental health, like actual mental health. You have to take it. When I was incarcerated, I had to take it up on myself to go to AA, go talk to my case manager when I was getting a little overwhelmed, and she didn't like it because she had a caseload that was way beyond what she could take care of. You're pretty much on your own. When I was incarcerated for men, I don't know how it is for the women. I would hope it would be a little better, but when I was incarcerated 13 years ago, I had to take it upon myself. As far as what I would like to see is that, I'm sure the state has enough money where they can hire some kind of mental health experts to come in and just, even as simple as being able to talk to someone about how you feel and what you're going through at that time would just be tremendous. How hard would it be for the facilities to hire 3 or 4, counselors? They don't even have to be therapists or anything like that. Just counsel someone for the inmates to talk to and express how they feel. There was none of that when I was incarcerated. So I would just like to see maybe, if someone, they don't have to be there all the time. Maybe someone can fill out a request to be able to, we couldn't even do that, to speak to, a therapist or something like that. So maybe something like that should be implemented.
Absolutely, Ryan. You are correct about that. And it wasn't much better at the women's facility either. The only difference was it was a little smaller at our facility. So it made it a little bit easier for me to go to my case manager. And only because also of the relationship that I had with my case manager, I was able to talk to her. And that was sparingly because, like you said, that they have so many caseloads that they're on the move, trying to get their job done, not talk to us about what we're going through in our mental or physical. But also, Damien, as you were asking about, is it easy to avoid? No, it's almost easier to get it in prison than it is on the street. It's right there. It's right there. And it's so much, and it's almost like the drug dealers there, they almost want to give it to you so that they can have some form of control or some form of control over you, or for them to feel like you need them, or however it is. But it's almost, you pretty much have to have a strong faith or a strong support system to not fall into the substance abuse in prison. It's almost kind of impossible to not. And for the availability of it, and nowadays the aspect of it, you can cash app in prison, you can do pretty much anything in there to be able to buy it, or you'll see people who are like runners for those people. Like, it's just like a whole system set up almost to sell drugs, to sell them, to get them, to use them. It's all of that. And I remember at one point, because I used them when I was there, just to put that out there. And it took a pretty good movement for me to get off of them, to the point where when I finally did get off, that it was such a encouragement for others, because they saw that it was it's capable of doing while being there, of doing it on your own. But like I was saying, I had such a strong faith and support system at home, and it took a lot of doing on my own. And it took about a year to even do that, which I think is it's hard, because I've saw the other people who wanted to be where I was, but just didn't have the things that I had in place. But if there were something like a 12 and 12 inside a prison, then I think it would be much easier to do so, because there's simply nobody to talk to or to even go to for those type of things. I remember making a fool of myself trying to do it. I actually went up to the desk and I was having an episode, and I was actually bammed on the window, and it was saying, somebody need to talk to me. I'm not locking down till somebody talk to me. Like, I had to put up a whole ruckus, and even to the point where when they would try to UA me or whatever, I would bring up the point of, if I fail this drug test and you give me a misconduct, then what's the point of that? And I've been trying to ask y'all for help. So why give me the misconduct? And not to say that I got out of it by doing that, but they didn't give me the misconduct because they realized it. And my case manager even said she's been asking for help. So let's not do this or whatever. So just saying, like, it's hard. It's so hard while you're in there. If you don't have something to do, something to look forward to, somebody pushing you, something in place besides voluntary things, because it also in prison too, which sounds so cliche, but it's like a high school in there. Like, if you're not a part of the crowd that's doing or whatever, doing the drugs or selling them, then you pretty much, you don't make it in there, because it's like a community in there too. So it's like, you gotta be in with this person or be able to communicate with this person, even sometimes to get food, to get canteen and commissary, because that's how they make their money too. So like, even if you want to eat, you gotta be a part of this site or community to be able to do so. And it's just not cool. Like, it's just not. So if there was something in there, like a therapy that we could go to, or just like Ryan said, somebody that we can talk to besides a chaplain or something like that, that they would just give to us or put in place, like just say, or kind of like, just go to this person for now. You know what I mean? Like, because they don't have any other answer. There just needs to be something that would even give the inmates hope of, I could do this.
And I wanted to say, piggyback, because I left out. When I was at the private facility I was at, I really do feel like, and I know for sure, some of the guards encourage drug use because it makes their job easy. Not for the people who being able to use drugs while they're incarcerated, it keeps them subdued once again, and keeps them calm. It gives them something to look forward to outside of being locked up in prison. And for the guys selling it, like Whitney said, they don't want any trouble. They don't want anything bad happening on the pod, because they don't want any heat coming from the guard bringing them the drugs, any attention being brought on them. And it just makes the life a lot easier. I hate to say, but in prison, drugs makes a life easier for inmates. I know it's a harsh reality, but it's true. And yeah, it's prevalent, because I had never seen heroin until I was incarcerated, believe it or not. I sold drugs my whole life, never seen heroin until I was incarcerated. So that's how prevalent it is. Never knew what oxycodone was. I learned so much about drugs being incarcerated, but it for me, it was a blessing, because I got to see where I would be headed if I was going down those stairs. All the guys giving me this knowledge would say, hey, bro, at your age, if you keep going down this road, you're going to be like me. And that's one thing that I was grateful for, that the only mental health, now that I think about, the only mental health help that I got while I was incarcerated were from guys that had been incarcerated a really long time, lifers, guys like that, guys been in 15, 20 years, sadly. And just seeing the potential and seeing what type of person I was, and would just give me encouragement and give me knowledge and make me not necessarily teach me about mental health, but make me aware of my mental health and make me realize that without that mental health and being mentally strong, I probably wasn't going to survive walking out of that gate.
There's a lot there. I think a lot of Oklahomans would be surprised to learn that there are more drugs inside of state prisons than there are in some of the communities around them, and that people are being put in a situation where they're actually being offered drugs and things that they'd never even seen on the outside world, but in a carceral context. How do we change this paradigm? How do we create some type of equitable access to mental health and addiction services, particularly for marginalized communities that might face additional barriers? There's an important piece here, I'd say, in the rural-urban divide too. For that first piece, how do we really target marginalized communities who have these additional barriers? Brittany, to you, thoughts on that?
I mean, I think the first thing is stopping and listening, right? So often we don't listen to people with lived experience. So, I mean, hearing from people like Ryan and Whitney definitely impacts the work that I do. I mean, I can go read 100 academic studies about what's working in Quebec, but really it doesn't tell me what I need to know about what's going on in Oklahoma and how policies are actually implemented. So first, for me, it's always like, stop, listen, survey, hear what people are actually experiencing. David and I came from the legal field. We very quickly identified as attorneys that working within the system wasn't something that we wanted. And so we took the policy route and we said that being an attorney is cool, but I can do so much more by looking at policy and changing policy and having these conversations. So first it's stopping and listening. And then I think it's really applying what you've learned in those conversations. And I mean, particularly, I think it's looking for solutions that you can tailor to Oklahoma. I think a lot of times we either come off as being too defeatist, like that will never happen, or maybe even too aspirational, as in we can solve everything in the world. But really, it's about looking at things piecemeal and understanding that more than recovery or more than rehabilitation, we're talking about recovery, right? When you're talking about rehabilitation, you're talking about a single individual solving an issue for themselves. When we're talking about recovery, we're talking about making up those lost family connections, building up community, and that's so much more a part of it. So stop and listen, figure out solutions that you can tailor to the community, and then really rely on partners and collaborators. Sometimes we tend to be a little independent and vigilante about the way that we try to change things, but it's really through collaboration and partnership that we're able to make a lot of changes and institute some of those things.
David, would you like to kind of speak to the urban versus rural divide, and what can we do about that?
Yeah, and we talk often, I think, in policy work about rural and the urban divide because of some of the reasons we've already mentioned on the call, which is that unfortunately Tulsa and Oklahoma City have vastly more programs and resources available for people who need it. So I think we have to start thinking about increasing access in every community across the state. It's really not enough to have really great programs and programmatic hubs or whatever, and Tulsa and Oklahoma City. It's just not. That leaves out a lot of Oklahomans that for various reasons might not be able to get to Oklahoma City or Tulsa, or they don't want to. They want to have treatment in their own communities surrounded by the people that they know and trust. And I also think we can see those inequities between urban and rural divide through the actual court programs and what's available for people who might be caught up in the criminal justice system in a rural county, for example. In Tulsa County, they have something called a misdemeanor diversion court. And what this does is it helps people get mental health and substance abuse programming. And when they complete it, they no longer have that misdemeanor charge. So you can see how that might actually change the trajectory of somebody's life, but that's only available in Tulsa. Doesn't make sense when we don't have these in places like McCurtain County that Brittany mentioned or others. And so again, when we're not thinking about the whole state and every community that we have here, it leaves out huge amounts of folks. And particularly when they're facing criminal sentences or just treatment, like we've mentioned before. That's not sustainable, and it's unfair to say it lightly, I guess.
When we talk about funding and we talk about the urban-rural divide, and I like to think about the resources that exist in communities, right? Mental health is often a long-term situation. We're talking about onset of mental health conditions often occurs before the age of 14. There are schools in every community. Schools are a place to connect people to mental health resources. If you're lucky enough to have a job, jobs should be places where you can connect to mental health resources. In my mind, the way to increase spending on mental health is really to understand and realize that mental health is an asterisk on every budget line item. If we want to talk about oil and gas, talk about the fact that like rural white men between 30 and 50 have the highest rates of suicide, right? Like we can talk about oil and gas and mental health in the same sentence, and too often we're ignoring the mental health asterisk that exists on every one of our line items.
And can I add something on that about kind of budget priorities just really quickly? I'd say that to lawmakers who are thinking about these investments, which they're doing right now as the budget is like coming off the presses, these investments also pay dividends and other things that we fund. So for example, when we increase funding for mental health programs, we will undoubtedly reduce funding needed for incarceration. That's what we're talking about here. That's just an example. Or if we treat substance use issues early, it's going to reduce the amount of money we're then having to spend on healthcare later. So if we really truly want people to thrive, and if we can provide the services to allow people to thrive, it's also going to boost all of us and all of our communities. So when we're trying to make these budget decisions, well, should we pay for this or this? Oftentimes, this is what we should be investing in if you care about all of the other issues. I just wanted to get that in while we're on that subject.
And Damon, I just wanted to say, you're talking about urban and rural divide, and I think about that a lot because I'm from Spencer, Oklahoma, and it's a small town. I often have to remind myself that we're all human beings and we're all going to make mistakes. Some of us are going to get caught. Some of us are not, but it doesn't not change the fact that we all breathe the same air. We all bleed the same blood. If you cut us open, we're all going to look the same on the inside. So I just think it doesn't matter if you're rural or you're urban. We're all human beings, and we all deserve a chance at living a just and healthy life. So I just think that people need to think about that more when they go to vote and pass laws, that if you have a drink and get in your car and someone sideswipes you, it couldn't even be your fault. But then you get breathalyzed, you're a criminal. It's that simple. Like, so people don't realize that some of us, yes, have made horrible decisions in our past, but anyone can end up in a position that I've been in or Whitney been in. And I just think we should all kind of think about that from time to time, because we all get caught up into how we feel and what we believe and what we think. But we all deserve a little bit of justice and respect sometimes.
That's really great. I think we've probably got time for just one more quick question to kind of summarize the things that we've talked about. Thank you guys so much for sharing this really wonderful community conversation on Mental Health Awareness Month with us. What steps would you all say that individuals can take to promote their own mental health awareness, to challenge these stigmas, and to advocate for the redirection of funds and resources towards things that really produce rehabilitation and that really help folks who are struggling with addiction? I'm going to actually start with Whitney, and then you guys can kind of walk through and everyone give us your final thoughts.
Yeah, I would say just getting involved in everything you can so that you can have a chance to speak up and talk to whomever you can and to share your story with whoever, because there's so much knowledge that can be spread amongst each other that can get you into many places. So I just think getting involved in everything that you can would definitely help someone.
And I'll piggyback off of her. I just want to say everything that's been talked about today, these conversations, we just got to keep having them, because this is what moves the needle. It may not move it that much, but if we don't continue to have these conversations and put like-minded people together and try to start moving forward, then we're gonna always be stuck in the past. And it's just wonderful to see that in our state that there's more and more people, starting to realize it and be a part of moving forward. So I just wanted to say that and thank everyone who's been a part of the panel and watching and listening as well.
Yeah, I want to thank everyone too, and Whitney and Ryan. I as Whitney said, we learn from each other, and that's an important piece. And even just from this hour-long conversation, I've learned so much from you two, and I just really appreciate that. And from my perspective, I always try to get this plug in, but you've got to reach out to lawmakers too if you care about these policy solutions, because fortunately or unfortunately, they make the decisions on how our money is spent, our tax dollars. And they can choose to spend them on good things or on bad things. And hopefully these conversations lead these lawmakers to a different path than we've been taking. So yeah, I just want to say thanks so much for having me here too, and learning from all of you.
I think a lot of the other panelists mentioned like community and making sure that we continue to have these conversations, but some of it even starts before that, and taking care of your own mental health. If you need help, reach out. If you are in distress, call 988. If you identify problems in your community, try to find solutions. I think that a lot of people don't think that they have as much advocacy or ability as they actually do. Tell your story if you have a story. Be willing to listen to somebody's story if they have a story to tell. So I think a lot of times it's about starting with yourself, and then once you've sort of established that, then building into the community. Because often, as much as there's stigma in the community, there's a lot of self-stigma, and that self-stigma is really, really destructive. So I think a little introspective, and then once you've got that settled, go out into the community, like Whitney said, really have those conversations, but don't forget about yourself in that.
Just so important, so important. Thank you all for this amazing conversation on Mental Health Awareness Month. For those who have not yet, please follow Oklahomans for Criminal Justice Reform on our social media. You can sign up to get our regular monthly newsletter and be a part of these conversations. We'll see you again next month. Thanks to all of our panelists. I hope the rest of you have a wonderful week. Bye, everyone.
Thanks, everyone. Good to see you.